Welcome to the Knox County Health Department's video series on heart health. In this 7-part video series, we will cover the basics of heart disease, how to eat a balanced diet, how to manage your weight, and how to live an active lifestyle, all of which benefit your heart health. These videos are great for anyone hoping to learn more about heart health. You're never too young or old to start taking better care of your heart. The information in these classes are not meant to be a substitute for professional medical advice, diagnosis, or treatment that you have received from a healthcare team. You should always follow the medical advice from your doctor regarding the treatment of your individual conditions, like taking medications or following a carb-counting diet for managing diabetes. Our first video is about the basics of heart disease. Let's get started. Heart disease is the leading cause of death for both men and women in Knox County, the state of Tennessee, and the United States as a whole. About 1 in every 4 Americans die from heart disease every year. Heart disease is often referred to as the silent killer because often there are no symptoms. Unlike conditions like diabetes, there are no clear signs of heart disease until serious issues occur. If there are symptoms, they often differ from person to person. In general, women are less likely to have symptoms than men. Sometimes you may experience angina or pain in the chest that can feel like indigestion, pressure, squeezing, burning, or tightness during physical activity. Other symptoms could also be shortness of breath, fatigue, or neck pain. In some cases, the first symptom may be a heart attack or stroke. Your doctor will diagnose heart disease based on your risk factors, which include blood pressure, cholesterol, sex, age, family history, genetics, and race, as well as your symptoms and test results. The tests that your doctor may perform can check for buildup in your arteries, check the strength of your heart, and detect problems with blood flow. The term heart disease is an umbrella phrase that refers to several problems involving the heart. These include coronary artery disease, congestive heart failure, heart rhythm problems, congenital heart disease, and endocarditis. In this video, we will focus on coronary artery disease because it's very common and preventable. Coronary artery disease is the most common type of heart disease. It's caused by a buildup of fatty substances or plaque in the arteries. Arteries, which you can see in this picture, are the blood vessels that transport oxygen and nutrients, including fats, throughout your body. The oxygen and nutrients that get delivered throughout the body are extremely important to keep us walking, breathing, and healthy. Normally, the walls of an artery are smooth and blood flows easily throughout our body to all of our organs. However, over time, the walls of the arteries can collect layers of fatty substances that reduce blood flow, causing the risk of clotting, and raise blood pressure in our body. The layers of buildup begin to collect when unhealthy fats and other substances get stuck on the walls of the arteries. Too much unhealthy fat in our diet is one of the main causes of this buildup. When the buildup in the arteries hardens, it becomes what we call plaque, and this plaque reduces blood flow to parts of your body. This is especially dangerous in places like your brain, heart, and eyes. This picture shows the progression of a healthy artery with normal pressure to a narrowed artery with higher blood pressure. So to review, atherosclerosis or plaque buildup eventually leads to coronary artery disease, which is the narrowing of your arteries that leads to reduced or blocked blood flow. This can cause heart failure, stroke, or heart attack if not addressed. The good news is that plaque buildup can be addressed. Treatment of coronary artery disease can include a heart-healthy lifestyle, medicine, and invasive surgeries or procedures such as a bypass surgery or heart catheterization. While all 3 treatments can help you manage heart disease, a heart-healthy lifestyle should always be included in managing heart disease. What puts people at risk for developing coronary artery disease? Having high cholesterol, high blood pressure, smoking, eating an unhealthy diet, having extra body weight or obesity, physical inactivity, and stress are all things that increase our risk for developing heart disease. A person's age, family history, gender, and sex, as well as certain conditions such as kidney disease and HIV, play a role in someone's risk. Some of these risk factors can't be changed, but others can be. This means we can take action to control our risk for heart disease. Let's take a closer look at how cholesterol and blood pressure are related to heart health. Cholesterol is a waxy substance that our body creates and that we eat in animal products like meat, eggs, and dairy. Cholesterol is necessary for many bodily functions, but it can build up to too high of a level if our body creates too much or if we eat too much. As the amount of cholesterol in your blood increases, so does the risk to your health. You cannot feel high cholesterol levels in your body. The only true way to know your cholesterol levels is to get it tested by a medical professional. This is usually done with a blood test called a lipid panel. A lipid panel measures the amount of different types of fat in your blood. Most of the time, this test is done after a period of fasting or not eating for 8 to 12 hours. Treatment for high cholesterol may vary from person to person, but it should always include a heart-healthy lifestyle. There are two main types of cholesterol, HDL and LDL. LDL is the type of cholesterol that builds up in our arteries. When we talk about bad cholesterol, we're often talking about LDL cholesterol, which we want to aim to keep low. HDL cholesterol is the healthy kind. We want to have higher levels of this. Our bodies make all of the cholesterol we need, so even if we ate no cholesterol from our diet, we would have all of the cholesterol that our body needed. Eating unhealthy fats can cause our cholesterol to get too high. The recommended cholesterol levels are total cholesterol less than 200, LDL or bad cholesterol less than 100, and HDL or good cholesterol more than 60. However, always refer to your doctor for specific medical guidance. If you have been told to take medication for cholesterol levels, making healthy lifestyle changes in addition to your medication is a great way to have a healthy heart. It's important to pay attention to cholesterol levels because high cholesterol can lead to heart disease, heart attack, stroke, or sudden cardiac arrest, which means the stopping of the heart. Another very important part of heart health is maintaining a healthy blood pressure level. High blood pressure may not make you feel sick, but it is serious and can lead to health complications down the road. You may not have any symptoms until it causes a serious problem such as stroke, eye damage, or heart attack. Because of that, it's very important to get your blood pressure checked at regular visits to the doctor's office. You can even check your own blood pressure at public blood pressure stations, sometimes found at pharmacies, or at home with your own device. Your blood pressure changes throughout the day and can be affected by stress, caffeine, or even having to use the restroom. It can be helpful to measure blood pressure at home on a regular basis to get a good idea of what your numbers really are. Before you're diagnosed with high blood pressure, your doctor may want to take 2 or more blood pressure readings during separate appointments to confirm that you consistently have high blood pressure. Treatment for high blood pressure should always include a heart-healthy lifestyle and sometimes includes medication, home monitoring, or a combination of these things. You have probably heard about high blood pressure, but what exactly does that mean? When your heart pumps blood through the arteries, the blood puts pressure on the artery walls, like water flowing through a garden hose and putting pressure on the inner walls. This is called blood pressure. It's normal to have some pressure inside the arteries, but we want to prevent it from becoming too high. Several things can cause high blood pressure. As the walls in the arteries become hard and thickened, in part from waxy cholesterol deposits, blood pressure increases. This is because the inside of the arteries is narrow, leaving less room for blood to flow through. This causes the blood to exert higher pressure on the internal walls. This is also called hypertension. Why do we care about high blood pressure? When a person has high blood pressure over time, it puts stress on the arteries and eventually damages and weakens them. Over time, this can lead to stroke, vision loss, heart attack, heart failure, dementia, and kidney disease. So what's the right amount of blood pressure? The blood pressure categories are shown here. They are broken down into groups called normal, elevated, high blood pressure stage 1 and 2, and hypertensive crisis. These are shown on the left column. Systolic blood pressure, or the upper number, is the amount of pressure present at the moment your heart beats, squeezing blood out to the arteries. Diastolic, or the lower number, is the amount of pressure present between beats of your heart, when your heart muscle is relaxed. You can see that the green line shows a normal, healthy blood pressure. A normal blood pressure level is 120/80. High blood pressure or hypertension is when your blood pressure is 130/80 or higher. So what are the things in your life that increases your risk for having high blood pressure or high cholesterol? Diabetes, unhealthy diet, lack of physical activity, obesity, alcohol, tobacco, genetics or family history, as well as age, sex, and race. So how can we have healthier blood pressure and cholesterol levels? Making small changes to eating healthier foods, being more active, reaching and maintaining a healthy weight, and managing chronic conditions like diabetes can make a big impact over time. Living smoke-free is also very good for your heart. Smoking damages all of the organs in your body, including your heart and vascular system. Lastly, knowing your blood pressure numbers and cholesterol numbers and talking with a healthcare provider about them is very important. All of these behaviors can help promote a healthier blood pressure and cholesterol level. That brings us to the end of our video about the basics of heart health. For more information about heart-healthy lifestyles, check out the other videos in our Heart Health series. With any questions, please contact the Knox County Health Department.